Another form of pain relief is an epidural. This is given by anaesthetist, who's a doctor qualified to give anaesthetics. This can take 20 minutes to go in, it can take 20 minutes for it to work. Stay nice and still. The doctor feels at the lower part of your back and they will numb that area, put a hollow needle into the epidural space. Through that needle, they will thread a little bit of tubing, and that's like a little thread in plastic. The tubing sits inside, the needle is taken out and the tubing is left in. And then the doctor injects some pain relieving drugs into the tubing, and that will numb the nerves that are coming from your spinal cord to supply all these muscles that are in your tummy. And that will hopefully take the pain away. Before you get an epidural, your baby has to have a trace done continuously on their heart rate. And we also have to commence an infusion, an IV infusion, which is a drip, and run lots of fluid into your system, because sometimes when you get an epidural, your blood pressure can drop, and in that case, your baby's heart rate could change. So we've got to keep a close eye on your blood pressure for the first hour after administering an epidural. We also have to monitor your baby's heart rate continuously. You can get an epidural from once you're in labour. There are no major side effects of epidurals that we know of. There is an increased chance of an instrumental delivery, which is forceps or suction. There is a slight chance of a very bad headache, and there's a slight chance of difficulty passing urine after delivery, but we can rectify these. So I would suggest to you, come in, move around, do your labour hopscotch, and then if you're not able to cope, you find your labour is going to be longer than you anticipated, an epidural is available. So wait and see. And as I think, I don't take paracetamol now because I'm afraid I might get a headache at 5 o'clock this evening. I take it when my headache is very severe and I can't cope. So wait and see how you're doing before you go for an epidural.